More music. Better mental health. Only on IPL Radio.
Hey, I'm back. It's Teresa here. Good vibrations. Missing Miss Mish terribly today. She's just having a day away that's much deserved and needed. So we've got some lovely guests in the studio right now, and we've got Meta, who is from, and she's going to say it,
Port Kennedy Central Dental Care.
And her assistant, or another lady here, is Louisa.
Laughing Louisa.
Yes.
Hello, everybody.
Come in nice and close.
Hello.
Yeah, fantastic. All right, ladies, tell me about your practice, Meta.
Well, we opened up in 2020 and we are almost 5 years old, and we see over 11,000 patients, and most of those patients that have walked through our doors have had dental anxiety.
Wow.
Yes.
That's a lot. Yes.
So dental anxiety is a very real thing. Mm-hmm. We take it very seriously, and we are all trained individually to help our patients with their dental anxiety, because there are all different forms of dental anxiety, so we customise our care for our patients.
And so what sort of anxiety has been your experience? Obviously, with so many patients suffering from it, what is the one thing that sort of, or maybe it's not one thing, but what are you looking for when you are noticing, or what have you observed as
So a lot of the time when patients call us to make their very first appointment, we almost congratulate them for that first call, because we already know by the way that they're speaking to us that they have been pondering about making this call, and it's a really, really big step for them. So once we build the rapport with them over the phone by listening to their concerns, so we listen more than we speak. So we really listen to why they're making the appointment. They tell us their story about how long it's been since they've been to the dentist and why they haven't been back. And then we share that with their dentist, and our receptionist is made aware of every single patient who offers any little bit of information to us about their anxiety, so that we can take extra care of them when they walk through our doors.
Okay, so what you're saying is your practice is actually different in that when I book a dentist appointment, I don't usually get that extra care. So do people contact your dental practice because they know that it's for people specifically who, no better words to use, hate going to the dentist?
Yes.
Is that what you're saying? So people will bring in children who are highly anxious?
Yes.
And even adults?
95% of our patients that come through our doors are from word of mouth, from their anxious friends who have been to see us and have had a good experience. So, yes.
Oh, wow. Okay,
yes.
That's really interesting to know. And good to know that there's one fairly local. But so whereabouts are you located? Where are you?
So we're along Wambrasand Avenue, and you'll find IGA tucked away in the corner.
Yep.
A lot of people might remember the old Bunnings in Port Kennedy, so we're just across the road from where the old Bunnings was, and we've got Gold's Gym on the top, upstairs, and we're on the bottom shop front facing Wambrasand Avenue. So there used to be a Cash Converters next door and a Westpac. Pretty easy to find. Wambrasand Avenue, yep.
Okay, I'll tell you a little story. When my children were young, I needed to take my daughter to a special dentist as well, because she refused to have the needle. She was just so terrified of needles. She's better as she's got older, but she's always had this fear. So what age group do you think that anxiety is predominantly children, or do you think it's not age determined?
What we find is there are more adults that carry dental anxiety than children, and I think that's because there's an excellent government school program where children are invited to visit the dentist from a very young age. So over time, the anxiety in children is less, but a lot of adults come with their dental anxiety because of things that may have happened, in the younger years.
Yeah.
So, yeah.
Because dental care is a lot more proficient now than it was back then, I can remember myself. But I've had such major work done on my mouth because I knocked out a tooth when I was young, so that did create many, many visits. So I guess the more often you go to the dentist, it could be to do with not going often as well.
Yeah, that's right.
But I went so often as a young child because I had a black tooth. It wasn't great being in high school with a black tooth.
No, that's right.
And primary school.
Yeah.
But eventually I was able to get a bridge and everything. But, of course, that meant lots and lots of needles. I remember the first bridge I got, it was I had 6 needles in my mouth. So at the top of my gums and 2 up into that hard section of the mouth, which was not pleasant, and I was so that wasn't till I became an adult though. So I think I had my own stuff, but I think that because I went so often, I knew what was going to happen. But it's got to do with frequency. So a lot of people don't look after their teeth.
Yes, a lot of people don't come to the dentist because of the anxiety. And what happens is if you don't come in for your regular checkups and your regular cleans and your care, so we don't just clean your teeth and check your teeth, we check for things like oral cancers as well, which is really important. And coming in every 6 months to have those short procedures but very important procedures done means that if there's anything that we pick up on that's small, not only will it be more affordable to treat because it's small, but it will also help you with your anxiety to come in knowing that, okay, today it's only a clean and a checkup, and, it's not anything more extensive and I'll be okay. So,
that's cool. And what about you, Louise? What's your forte? What's your expertise over there?
Laughing.
Laughing, Louisa.
Yes.
It's mainly to make the patients feel comfortable, get them to relax, calm them down, just let them know that if somebody's really anxious and they come in, we sort of speak to them, calm them down, explain exactly what we're going to be doing, even if the main objective for that appointment is to take 2 x-rays. As soon as they've walked through the door, we're just getting them to relax a bit, let them know we'll just take it at your pace. We're going to put this x-ray in your mouth. It'll be in there for 5 seconds whilst we press a button, and just explaining it. Sometimes if people do sort of start freaking out a bit, then we just stop what we're doing and just let them calm down and explain
what's happening,
what's getting them so upset.
We work with the patient.
Yeah, we're just
so they're in control, because sometimes anxiety can come on because of the fear of the unknown. And working in the mouth is a very personal space for someone as well. So we're really all together as a team. So we're always known as the dentist with a difference. So that's why you see Louisa with her badge, Laughing Louisa. We have a nice Nikki that should be renamed Naughty Nikki. I'm sure she's listening right now, laughing her head off. We have a cool Kiara. We have a cool Kiara who is really cool. She's at the front desk, and this morning somebody said, "Is your name Cool?" And she said, "No, it's Cool Kiara." So who else do we have? We have amazing Anthea. Yeah.
Sparkly Sharon, because she likes to wear sparkles.
She loves sparkles.
My name's Teresa, so what would I be?
Terrific Teresa.
Tasty. Okay.
Teresa. Terrific Teresa.
Terrific Teresa.
We have a fantastic Fernanda. We have, we have, everybody has something fun and inviting. So even when you first walk in, it doesn't feel like a dentist. And that's the comment we get. It doesn't feel like a dentist here. So we have a lounge, we have couches. Or
Do you get to sit in the lounge while the dentists are doing their thing?
No, you get to sit in the lounge, and watch TV. So, and it's not just any TV. It's relaxing music. It's meditation music almost.
So it's like going to the spa.
Yes, it's a very spa-y feel.
With that.
So, yes. Yeah,
good.
we used to have aromatherapy, those little thingies that have the the aromas coming out of
our
them.
next guest
Forgotten
is
what they're
actually going
called.
to be talking about aromatherapy.
Yeah.
And what a good combination to have you guys in first talking about anxiety and then
That's
to have
right.
aromatherapy as
So
well.
yeah, we do offer different scents that people associate their calmness with. We have candles and that sort of thing. We have a relaxation room that's specifically dedicated to the extreme anxious patient where they don't want to be in a waiting area or a reception area with anybody else because they're already really anxious about their appointment. So we invite them into the relaxation lounge.
Well, just on that, okay, so you're both dental nurses,
Mm-hmm. Yeah.
but this is your practice.
This is my
now.
practice, that's right.
Let me ask you a personal question.
Sure.
You've started this practice for a reason.
Uh-huh.
Why?
We are a dentist with a difference, and that's the reason why I started it. So
Because of your own experiences?
no.
Or-
I just know that there are so many people out there who have dental anxiety, and there are amazing dental practices out there, and a lot of them are starting to think outside of the box and offer things like a relaxation lounge and help yourself to some fresh refreshments and that sort of thing. But when we first started, we already started with the end in mind, which was to create a practice that would help with anxious patients. Yeah.
And so when it comes to the mental health side of dental practice and your particular dental practice, what would you want to tell or our listeners to know about?
To know that we take your dental anxiety very seriously. We focus on you as an individual. We care about you. We will listen to you. We will never judge you. And we're here to help. So, and we want to know what it is that you're anxious about. So when you share that with us, we can better help you when you're ready. And a lot of the time our patients are ready to tell us straight away because they've already come to us recommended by somebody else who's had a good experience. So they already feel a little bit comfortable, and they know by sharing their anxiety and what their triggers might be that we can help them better.
Have you got, I'll ask Laughing Louisa this, have you got a story that you want to share with us with a particular client that came to your practice?
Yeah, we've had a few where even making the first phone call, they've been like upset on the phone and just like crying. And it's like, we need to get them in first. So we just speak to them calmly and say, look, you come in, you can even just sit in the waiting room, see how you feel, and then we'll take you through. So I remember we've had a couple of patients where it started off like that. They were like just so nervous. And then we get them in and they'd come back for fillings, dentures, treatment, whatever they needed. And within 3-4 appointments, they'd come in practically skipping through the door. And they're like, I cannot believe how I feel. It's so different. I'm like, I never thought I'd get over this. But and they enjoy coming like once every 6 months so we can keep in touch with them.
Yeah. So they always walk out the door with a compliment. Thank you so much. I never thought I would actually overcome my fear. And they do come back without delay, So it is definitely...
It's a really good way to look at all mental health and facing fear, which I did talk about a little bit earlier about facing our fears. So that is one fear that many people, like they see it as what do you call it? I was going to say like a priority or very high fear factor going to the dentist. So by introducing themselves to go to a practice like yours that has that sensitivity to their clients, and then that is facing it. So that's facing it. Each time they do it, it becomes less, and after a while, it's like, oh, why was I so worried about it?
Yeah.
But it is about that patience with clients, but also. That can be for a lot of different things, how we treat one another when someone's going through a struggle and we think, oh, why are you struggling with that? I don't understand, because it's not your fear.
Yeah.
But this is directly related to
even though us as staff don't really have, all of us who work in our team, we haven't really had a reason to have dental anxiety, because a lot of us have been in the industry for such a long time, but we know someone in our family or our friends who have had it so severe that we can empathise with our patients. And what we love about the anxious patient is that they actually are brave enough to make that phone call to us, and they trust us. So it's almost like a privilege for us to see them, and that's how we see it. So like Louisa said, when they make that phone call and we answer the phone call, we firstly tell them, well done for making the phone call. Now this is your first step to overcoming your fear, and not only overcoming your fear, but helping yourself with your dental issues for a better health, mental health, because not having the smile you want affects your mental health, like you mentioned before about your black tooth.
Yes,
yeah.
Yes, it did. My confidence
You've got beautiful
was low.
teeth now.
I didn't smile.
Yeah, that's right.
And yet people say, Teresa, you've got a great smile. If they only knew that I spent most of my childhood not smiling, or with my hand over my face, covering my face.
That's
through being so self-conscious of it. And then many, many years of just having like this white little blanket put over the top of it, so it's thicker than the other teeth to cover the black. Yeah. My confidence was very, very low. And it wasn't until I was 25 that I had my first bridge. So you can imagine all those years of... And then my life was changed. I was able to really smile, and I have been smiling ever since.
That's what we hear, isn't it? You changed my life. That's what we hear a lot.
And patients, like, they first see themselves with their new smile, and they
cry.
They cry, and then we all end up like,
and then we all cry.
It's like, oh, you look so beautiful. And like the amount of times we hear people, like patients, and they're like, I've got my smile back, and it's like you just feel so good for them. It's like
I totally get that. Let's take a little break, and we'll get ourselves a drink of water, and we'll be back. But right now, I'm going to play something that's a little bit more current, not 80s. Probably going to get a smack from Mish later. But here's a bit of Harry Styles. Who doesn't like a little bit of Harry Styles?
More music, better mental health. Only on IPL Radio.
And we are back, and I'm back with Laughing Louisa and Meta, but we thought we'd call her Miraculous Meta.
Sure.
And because Meta likes to make sure the clients are comfortable as they can be.
Well, it's my magnificent team who does that. We do all that together. However, usually I'm the one who will answer the phone call from the very nervous patient. So I like to get to know them on the phone and how we can help them.
Yes. Okay. So let's talk about the types of treatment you offer your anxious clients.
Sure. So we can offer them sleep dentistry. So they can enter a deep sedation via an anaesthetist who comes to visit us in our practice. And what that means is they don't get to hear any sounds, and they don't get to feel any pressure or any amounts of pain, and they're asleep. We do all the dentistry they need, and then they wake up, and they're not aware of anything that's happened in the chair, or the treatment that they've had. Obviously, we show them what they've had done, and we go through everything beforehand so they know they've had the treatment done, but they're asleep the whole time. So that's a deep sedation.
Okay, and that's for children and adults?
We refer children. It's a lot safer for them to be seen by a paediatric specialist, but we do adults in our practice via an specialised anaesthetist.
Okay, so you refer them on to somebody else?
We refer the children on, but adults who are extremely anxious and would prefer to be asleep so they don't hear anything or feel anything, then we offer the sleep sedation where the anaesthetist comes in, works together with our dentist. The dentist does the treatment, and the anaesthetist is there the whole entire time, monitoring all the vitals and making sure that they're okay and safe. And patients completely unaware of all the treatment going on. So, because for a lot of people, the sound of the drill is what brings on the anxiety. And it's just not an option to hear that.
It's the needle.
So it's different for everyone.
Yes.
That's right. Yeah.
And then I'm fine.
Yeah.
I can't feel anything. But
Yeah.
that buzzing sound can definitely, make your head shake a little bit.
Yeah. So for
vibrates.
people like yourself who don't have that extreme deep anxiety where you're okay to hear a few noises here and there for a little while, we can offer you a Valium, which is a form of medication that can be taken to help with your nerves. So
that's interesting because even when I was having my front tooth ripped out eventually, so I was in my 20s and that's when I got my first bridge, I was not given anything.
Yeah.
Yeah. And the dentist was actually on the chair pulling my tooth out. I could hear it going.
We hear that a lot, don't we?
Do ya? It's old school dentistry, is it?
The knee on the chest. We hear that a lot, don't we?
Yeah. He struggled to get it out because even though the root had died in there, it was in there nice and strong. Just a little side note. So we did have a chat during the little break there about the splendid, amazing coffee machine that you've got. It's got a special name.
Yes, we have a coffee machine called Dolly. So if we offer that to our patients, that's that on offer.
So how do you say that? So would you like a
Dolly?
Would you like Dolly to serve you a coffee?
No, we do. We do ask them if they like a coffee, but the machine is called Dolly because there's a meme of Dolly Parton singing Jolene, except she's singing caffeine instead.
Caffeine.
That's
Caffeine.
So we called it Dolly.
Yes.
We're in need of caffeine.
We are always in
Very
need of
good.
caffeine.
So you guys just sing it around the place, do you?
We don't even have time to do that, do we?
Just send each other a message going, Dolly.
Very good.
Yes,
Excellent.
yes. But no, it's a fun place, and that's the other thing is we are a team that are like a family as well, and patients, any patient, not just patients with anxiety, but someone who walks into a business and can feel the atmosphere of how the team really gets along.
Yes.
That makes a huge difference in any anxiety, really, in any business. So whether you walk into a medical practice, a dental practice, a chiro, anywhere, any business, even a restaurant, if you can feel the atmosphere where people are there for each other, then you know you're in a good environment and you feel safe straight away. So
you can definitely tell when you walk into a building, you can feel it when everything's just, well planned and thought out, and everyone gets along really well and are kind to each other.
That's right. And no matter how busy we get, sometimes we can see up to probably 60 patients a day on a really busy day.
Wow.
Because we see emergencies.
How many dentists do you have there?
On a given day we have 3 dentists, so in total we have 5. 2 of them are part-time, but we have 3 rooms operating 6 days a week, and on Sundays we have 2 rooms.
Yeah, you were saying about a lot of your clients come in on Sundays. So it's a busy day for you guys.
Yeah, very busy for us. Yeah, so we do try and get.
Do you ever get a Sunday off?
We all take turns. Yeah,
okay.
yeah. So we try and it used to be when we first opened, it used to be just me. So, but as we grew very quickly, we got some Sunday staff on, and it's a bit of a roster to try and even it out. But there's a lot of people out there. Well, our team members don't mind doing Sundays. It fits within their schedule. So some of them have are students, some of them are mums with adult children, so it works better for them, but we all share it around.
You talked about the 2, so Valium and going to sleep. Is there any other that is less, that is drug-free that people can try before they...
So drug-free is more of our aromatherapy that we talked about before. So just associating a positive scent as soon as you walk through the door.
Yes.
So,
and you're saying that the place smells like lavender?
Well, we have a little bit of everything that it smells like. Just depends on what candle I've got going at the time. Okay. But our diffuser that we had was very much lavender, because lavender is the soothing kind of aroma that we got a lot of good feedback from. So
beautiful.
But yeah.
Okay, and I just want to thank you, ladies, for coming in today and sharing what you do and offering this community service. So what else would you like our listeners to hear? And also where you're located and...
Yeah, so just to know that we're here for you. So we won't judge you ever. We'll always be available for you when you have a question, need advice, or are in pain. Even though we are fully booked out most days, if you or a loved one is in pain, please give us a call and there'll be something we can do to help you. And just remember that we're here to listen, and, making that very first move and that very first phone call is a very, very brave thing to do, so you should be proud of yourself.
Absolutely. Thank you so much for coming in. It's been
Thanks
lovely
for having
to talk
us.
to you, ladies. Thank you, Meta and Louisa.
Thank you for having us.
More music. Better mental health. Only on IPL Radio.